Doctor, you talked about the mother and how important her health is, and you mentioned her being anxious. Or can you talk about the relationship between depression, anxiety, and ADD and ADHD?
Well, not entirely, but for the most part, it's a family of genes, genetic propensities, I would call it. And there's Dr. Kenneth Blum did a lot of work in that regard many years ago. And there are genetic markers for this. It's ADD, ADHD, it's depression, anxiety, bipolar, Tourette's, kind of like a real catch-all. And so there is a relationship, comorbidities. There's also a tendency toward addiction. That's a major problem with ADHD, and that's another reason that I'm for training the brain and getting good balance rather than giving a pill, because somehow that's not going to fix this addictive tendency. So the anxiety and depression kind of go, are more likely to be with the ADHD. Also, the environment around the ADHD child is going to be more likely to create the anxiety and depression. But then anxiety and depression in and of themselves have their own brainwave patterns. And there are ways of training that so that, for instance, Davidson at the University of Wisconsin did a whole lot of work with depression. And what he found was when the left frontal lobe was less aroused than the right frontal lobe, there was going to be a tendency toward at least a half-empty glass, if not depression. And so with neurofeedback, we can train up that left frontal lobe and balance it more with the right frontal lobe. And we also have a brand new technology in our office that we are excited about. It is like a miracle. It's transcranial electrical stimulation. And it's FDA approved for depression, anxiety, and insomnia. What we're finding with our medical director and being able to use some things off-label with her, we're finding that it has a lot of effect, because what it does, it targets the hypothalamus. And the hypothalamus is really the brain's brain, and controls the autonomic nervous system, the rhythms, the pulses, the cycles of the body. So when we start targeting the hypothalamic limbic area of the brain and get it in good balance and in its homeostatic place, and we are balancing out the neurotransmitters, the neuromodulators, the neuropeptides, etc., then what we've got is a much healthier person, and depression seems to go away. Anxiety seems to go away. In fact, we've even had probably in the last year 3 or 4 really severe bipolar patients that they were hearing voices. They were really more in psychosis. And in 3 weeks, they were pretty normalized and were out of their psychotic episodes. And I believe all of them are off medications. Wow. And we've checked on them. It's been almost a year now, and we've checked, and they're still working fine. So depression and anxiety are major problems in the United States, and it's increasing all the time, partially with our world and our lifestyle, and partially, I think, because of the way we're treating it, because antidepressants over time, I believe, do us no favors and sometimes make it worse because of, we're blocking the reuptake system of serotonin, and so over time we're depleting serotonin. And to me, it's logical to give the body what it needs to train the brain and give it the nutrition so that the body can produce more serotonin rather than our giving it a pill.